Hey y'all, it's Dr. Ashtiani here. I have two of my patients. I'm going to have them introduce themselves.
I'm Katie Skaggs.
And I'm Hunter Skaggs.
And we have Katie, who came to our office during her second pregnancy. I'm going to kind of have her share with you guys her experience about her first pregnancy compared to her second one, and then we'll kind of go from there. So if you want to go ahead.
Okay. My oldest daughter is 18 months old. The first pregnancy went pretty well. We had, normal symptoms, being sick and having some back pain and things like that. But overall, it was all right. During the labor and delivery, that was pretty tough. My labor was about 36 hours long. I planned to have a natural birth, and unfortunately, at 24 hours, I had to get an epidural, and things didn't quite go the way that I wanted them to go. And so it was pretty tough. It was pretty tough going. Everybody was healthy and happy afterwards, so that was great. This time around, I felt like I needed to get in front of some issues. I wanted to go into labor and delivery more healthy and with less pain. So I met Dr. Ashtiani at a nursing event here in San Antonio. And I decided, later on in my pregnancy, when I was starting to experience some back pain, that I wanted to come in and hopefully get some relief for that. I also was exercising more this pregnancy, just generally taking better care of myself. So this go around, I came into, I guess I was coming to Dr. Ashtiani, like 12 weeks or so? It was at the end of my pregnancy, and the morning I went into labor, I kept my appointment. I came in and I told her, I think we're gonna have a baby today. Got an adjustment, and maybe 5 or 6 hours later, I had a baby. This go around, my labor was only about 5 hours long.
How long were you in the hospital for?
Within an hour of arriving to the L&D emergency or triage, I had a baby. So I got there and I was fully dilated, ready to go. They rushed us up to the L&D floor, and I pushed for maybe 5 minutes. It was a far different experience than the first one. I was able to move freely the whole time. Actually, yeah, before I went to the triage unit, before I went to the hospital, I was walking in the mall, which was so different than the first time. But yeah, they were able to let me move around. I was feeling better, and I delivered this one standing up with about 5 minutes of pushing. So I definitely feel like taking better care of myself this go around was a good decision, and it definitely made a difference as far as my whole pregnancy went. But also specifically for labor and delivery, it helped a lot. Between exercising more and definitely chiropractic care kept everybody moving in the right direction.
I feel like a lot of times, majority of our patients come in because they're experiencing back pain. So they're like, I want to come in because I want to be out of pain. Or they're like, oh, I'll just wait till I'm hurting, then I'll come in. But no one ever thinks about the actual delivery part and how us working on the biomechanics of the pelvis can actually make a big difference. And I know when we had spoken, Katie's mentality was, I had a really long delivery with the first one. I'm kind of already planning for that. That's where my mind is. And, no matter how much I was like, have hope, things can be better. She was like, I've been there, I've done it, I'm already kind of expecting that. So, what was your shock in seeing the actual difference? And, that's something, again, you weren't even thinking. You were just thinking, getting out of back pain.
No, I can sum it up when I got to, the triage unit, and they told me I was ready to go, any minute now, could start pushing. I was just floored. I thought I was going to get there and last time have to wait for hours and hours. When I was examined, I thought, oh, surely it's only 6 centimeters or something, and I'm going to have to be here forever. But she said, no, let's go. And it was so surprising. Yeah. Probably the worst part about the whole experience was when I got there and had to lay on a bed for he says it was only 15 or 20 minutes, but...
Well, they didn't realize how far along you were.
Yeah. Oh, no.
She didn't look like she was in any distress.
Yeah, I came in and I was like breathing kind of hard and got kind of quiet, but I suppose I didn't appear to be
very composed. No one would have had any idea.
So that was a lot different from the first time too. I was a little more in tune with my body. Like I knew how, and I knew how labor felt. I knew what the intensity, what to expect that way, but I didn't know to expect like, oh, it can actually be pretty pleasant. It doesn't have to be terrible. So, and even the last pregnancy, I went in there thinking like, I can do this. I had a really positive outlook.
So Dad, tell us a little bit about what you kind of experienced from being dad, being at home, kind of what you saw from her coming home from her appointments and what she told you, I guess, and then what you saw from your perspective during the delivery moments.
Yeah.
Or her actually calling you at the mall.
For
saying,
sure.
Hey, you want to come with me?
Yeah, there was a huge, I guess, level of confidence that I guess was different from the time before and also different from before she had started seeking your care. She was calm and, like you said, in tune with how she was feeling. And just generally felt better. She had back pain last time she was pregnant, but it felt like her entire back. And this time she knew where it was, and it was a very limited place, and was getting relief as well. She told me to go to work the day she delivered Riley, and I did because she said, well, I kind of went into labor last night, no big deal. We know last one took a long time. She's like, it's not like active yet. I can just kind of feel it. We're still gonna go to our chiropractic appointment. We're still gonna do that, and then you just go back to the meeting you have after that. I'll go walk at the mall. When you're done with the meeting, just come meet us, and we'll see how it's going. We'll keep walking. So we go to the appointment in the morning. I go to my meeting, and I call her afterwards. She's like, yeah, not a big deal, but my contractions are like 2 minutes apart now. So you should probably just come straight here. Maybe you won't walk. And I'm just gonna call the midwives and let them know. By the time I got there, she's like, yeah, they told me we need to come in, so we'll go ahead and go on in. Drove to the hospital, got admitted and delivered a baby. So it's just an incredibly different experience than it was the time before.
Excellent, I love hearing that. And then lastly, will you just kind of share, you shared your story, and then maybe kind of share from the mom's perspective how you felt and coming and seeing a chiropractor, because you guys aren't from Texas. So how was it meeting someone new, a strange person, strange off, everything's new, right? So kind of walk us through what made you want to come here, and then also what led you bringing your husband as a patient here as well?
Sure. So like I said, I met Dr. Ashtiani at a nursing event here in San Antonio, which was great. She gave a chat and talked about some stretches and exercises, for expectant moms. And I learned there that she's one of only a handful of people here who can actually work with pregnant ladies. So definitely, I liked her there, and I wanted to come and see her at her office. So I decided to come in, and when we came, everybody was so welcoming. Her office is beautiful and accessible, and I really like the homey sort of environment. I've got another little one here, and she loves coming to Dr. Ashtiani's office. She plays with the books and toys.
She has a wonderful time.
Right. I like the focus on the caring for the whole family. I like that anybody can come here, not just me being pregnant, but the babies if they needed something. And then I convinced my husband to come and get adjusted for the first time ever, and he's hooked. So I really enjoyed that you can care for the whole family here, and there's something for everybody.
Thank you, I appreciate it.
I also like that you work in a lot of different treatment modalities. I've had chiropractic care before where I'm from, and they just do the back cracking, or I've never seen someone who also does acupuncture and who also does Graston and has a massage therapist on staff. So that was also really one of the attractive things that led me to come to your practice, was that it's kind of a one-stop shop. And I like that you are the provider of most of these things, so I don't have to meet another person. So that's why we like coming here.
Awesome. I appreciate it, guys. So thank you guys for watching. If y'all have any questions, feel free to send us a message, a text, or a phone call, and we will get back to you guys. Bye.